just enough to lose it all. Universal healthcare in America.
Imagine a society where if you're just above the definition of poor, you cannot get help. This is America.
The debate on universal healthcare has been going on for a long time, long being touted by presidents such as Theodore Roosevelt, Harry Truman, and Bill Clinton.
Measure of opportunity to achieve and to enjoy good health.
With diminishing returns. It started to pick up steam with the signing of the Affordable Care Act, known as Obamacare. However, it is restricted to Americans with pre-existing conditions, and by being filled with loopholes that undermine the Act's integrity, it diminishes the effectiveness of the Act helping everyday Americans. Universal healthcare is a health insurance system where all particular country residents have access to adequate healthcare. Many countries like Canada, the United Kingdom, and Sweden already have a form of universal healthcare, and the benefits are showing reduced mortality, increased life expectancy, and happier citizens. Some believe that there should be a combination of public and private insurance options, or universal healthcare could lead to socialized medicine and higher taxes. However,
Universal healthcare will ease the burden of getting medical care for many who don't have enough money for private care, the burden of not being able to pay, and the bills piling up is a vivid reality for many Americans. According to the National Bankruptcy Forum, medical debt is the number one reason people file for bankruptcy in the United States. Seeing that around 16% of Americans don't have any coverage, healthcare is not that affordable for many Americans. If all Americans had access to adequate healthcare, medical debt would not be as much of a problem.
Research suggests that it's pricing failures, middlemen, and inappropriate medical care. The politicians primarily talk about different ways to finance the broken healthcare system. We need to talk about how to fix the broken healthcare system.
Those without health insurance have a 40% increased risk of death, causing up to 44,789 deaths per year. According to a study in The Lancet, a peer-reviewed medical journal that looked at data from over 100 countries, said the evidence suggests that broader healthcare coverage generally leads to better access to necessary care and improved population health, particularly for the less wealthy. Many Americans suffer from the lack of hospitals due to the increased commercialization of the hospital system. The current facilities are often left understaffed and undersupplied, making it hard to do medical procedures that larger hospitals could handle easily. Having a universal healthcare system might lead to improvement of patient outcomes in more rural facilities while increasing medical literacy.
Seeing that Americans are 50% more likely to not obtain needed medication compared to their Canadian counterparts, the state of healthcare cannot stay like this for long.
One of the most used claims against universal healthcare is that it could lead to socialized medicine. But is that really true? Many countries have universal healthcare, but they don't count as socialist or communist.
One example of a country that has universal healthcare is Canada, but it is not without its problems.
Hospitals en masse are going to go out of business. People are going to stop going to medicine because there's not enough reimbursement. Or we're going to have to make up the $3 trillion shortfall over the next 10 years with, guess what? Higher taxes or printing more money.
Universal healthcare in its inherent nature will not lead to a single-payer system. According to Verywell Health, an award-winning partner of the Cleveland Clinic, a country can adopt a single-payer approach without a socialized medicine approach. For example, the National Health Service in the UK is an example of a system in which the government pays for services and also owns the hospitals and employs the doctors.
The US spends most on healthcare per person out of any country, but still ranks last out of the 16 richest countries in terms of preventable mortality.
Universal healthcare could be a solution. An article called Is Our Healthcare System Sick? By Stanton R. Maher makes the observation that if 40,000 people each paid $5 per month into a national health insurance fund, it could provide $2.4 million to pay for preventative healthcare, which is true. The Centers for Medicare and Medicaid Services reported that the average American spending on healthcare was $11,172 in 2018, which rose from $10,739 in 2017.
According to this average, the hypothetical situation created by Murr could provide healthcare to about 2,148 people. With the election that just came up, it seems that the new attitudes of the government are supporting a system of universal healthcare.
Of America should do what virtually every other major country on earth does and guarantee health care to all people as a human right, not a privilege.
Seeing that they are planning on bringing back systems and adding some that are somewhat similar to it.
Dramatically ramp up healthcare protections, get Americans universal coverage, lower healthcare costs as soon as humanly possible.
Maybe the new government will influence the public's opinion on universal healthcare, but not much can be certain for the future of healthcare, and if people's well-being is at stake.